Hey, hi. Today I will talk about my wisdom teeth experience, and I just went to the doctor today only, and she said my healing was one of the best she has seen in recent few months by any patients. I'm kind of surprised, but I would say it turned out good for me. So luckily, actually, uh, that it turned out good because I was not expecting it to be so easy. But okay, so let's start from the scratch. So it's a month back. Uh, the doctor told me, hey, we should get your wisdom teeth out. And I was like, hey, I don't have any pain. There is no jaw pain, nothing in gums. I feel good. So why? Reasoning was you have four wisdom teeth, and it's difficult to clean your teeth when uh, you have wisdom teeth, and in future it starts creating problems. So she said it will help your teeth align, and there's a small gap here in my teeth, so it will help in that as well when they do the implants or whatever the alignment they want to do. So she said it will help long term, let's go for it. So I'm like, yeah, fine. So I was totally chilled out and assumed it will be an easy procedure and all, because I had a huge procedure last year in February. So I thought, yeah, it will be an easy one. Like, I didn't worry about it. I just, when I told my family like few days before the procedure, they were kind of panicked. Like, dude, are you really sure you're gonna get all four done? It's not easy. You're on your own. Who will give you food? And because you have to eat only liquid foods and maintain, have antibiotics and things, everything regularly. So they were kind of not fully sure if I'll be able to manage all of this by myself, and especially it's a foreign country. Due to COVID, I can't just call people to help me as well. Uh, so but I said it's decided. The expert is decided. She wants to do it, and if she's confident, I'll go for it. Then I was telling it in my office as well, like, guys, I'll not be available in second half, and they also started giving me the same gyan, saying, "Hey, dude, like it's not that easy." Um, then I realized, okay, if multiple people are saying it, it will not be that easy. So I did tell them, okay, I will not drive there, and I'll take my I'll take a cab, because that seems a little wise. The doctor did tell me, like the doctor's assistant, not the doctor, the receptionist told me that, hey, you will give you, anesthesia and gums only, the place where we take out the tooths, and you can drive. So I was like, yeah, this option available, but the office people are like, hey, dude, take a cab, don't drive it. It can get stressful. You have to get anesthesia. Some people are confident as well, saying, hey, they got it out in 10 minutes and were able to go ski. So I was like in two minds, but I did feel like, okay, let me not drive. Fast forward, next day, 11 a.m. was the appointment, and till 10:30 I am sitting in a meeting, and the meeting kept on going, and I had like 20 minutes left, and the drive is 12 minutes. I tried seeing a cab. I'm like, dude, the cab will not come in next 20 minutes. And I don't like to go late. Okay. I like to go on time on my appointments. That gives me that comfort of not rushing, and you go a minute earlier, just sit, calm down, and they come and they're also aligned. So I thought it's fine. Let me just take my car. So I drove there, and there I was. Doctor said, "You're ready?" I said, "I'm ready. Take all four of this out." She explained to me that in a wisdom teeth, there are odd times, like in the rarest of rare cases, complications around the break your sinus, like this, it's here, or there are some tears, muscle tears that can happen. But I was like, yeah, fine. It's rare. If it happens, it happens. Then she started. I thought it will be a half an hour thing. They will just do some magic and take the teeth out. But to be honest, my first teeth took 1.5 hours of drilling. It was, I don't know. So the tooth was kind of, so you have the root like this, but the tooth was kind of hinged like this towards the other tooth. So it was like kind of like this. So the more you take out, it tries to take out the entire flesh. So it was like damn, root was damn strong and hinged. So The doctor did show me the X-ray and told me before, hey, this tooth looks super strong and it looks super hinged on the other tooth. I don't think it will be so easy. Might take some time. So I didn't know. So she gave me to start with an anesthesia, and that was local, like an injection on the gum. You don't feel it much. It is an easy injection, and no sedation, no like general anesthesia. I just had basic gum anesthesia, and they started like they put so much pressure on your teeth. It's basically they have two three instruments. They put so much pressure, drill it inside, try to move it like a screw, and they keep trying to move it. And then she felt okay, it's not happening, this and all. Then she took out heavy instruments like the drills and all. They literally drill. I was seeing it in her glasses, basically what she was kind of doing, and so that was scary. You know, there were times I was like literally shivering, like okay, because you can really see it live. What's happening with you? That someone is digging inside, on your teeth. So that was tough. That was tough. Sitting that this phase of 2.5 hours, if someone is digging, your jaw has to be continuously open. So she did give me breaks. She did say whenever you feel uncomfortable, just tell me. You raise your hand, and we'll stop. We'll give you breaks. So we did take 2 3 minutes break because she also wanted to break. And the anesthesia, after like 30, 40 plus minutes, it starts reducing. The effect starts to fade away. She did tell me, if you feel pain, let me know, because I have to give you more, but you have to let me know. And there was this time the anesthesia was super low. She applied strong pressure, and I felt it. The anesthesia effects were literally gone, and I kind of literally jumped, or like just did this, and I got a small lip cut. Like, I guess it's all healed now, but the lip got cut. She told, dude, don't move, don't. You're not supposed to jump out. And yeah, it was a small, like nobody noticed it. It's fine. It's fine. So I got more anesthesia. She kept on trying, and finally, after more than 1.5 hours, the first teeth came out. Then she told, okay, take 5 minutes break and just sit up, and we'll go for the second one. But she told me, we are not going for all four ones. We have already done so much on you that it will be sore. It will be tough starting tomorrow. There's so much drilling done. So post that on the first teeth, she started sealing it with sutures. So there were like 3 4 thread stitches she gave. And the stitches part is tough actually, more than the removal, because they're like stitching right in front of you, putting the needle in, and finding the needle. So there are like two doctors. The other one is just finding the damn thread, because it's so much small space to operate. So that was, I felt, was tough, where they're trying to stitch that. But yeah, that got stitched. The upper treat, I guess they took just 30 40 minutes, and that came out fine. But the time after that was more than 30 40 minutes she took on stitching the upper one, because it's difficult for the needle to go like in this angle up where they stitch you up. So it took good 30 minutes plus for them to stitch me up. And yeah, I went in at like 11:15. I was there, and it was literally 2:30 or 2:40 when I finally, they said, okay, you can sit, everything is done. And I was so tired, and the anesthesia effect, like it was on the face, but it's kind of on my head as well. Like I felt pretty dizzy and tired. So then I told her, hey, will I be able to drive? And like with a very feeble voice, I can't open my jaw big time. It was like, can I be able to drive? So she's like, oh, you came by a car. I thought you came by a cab. I said, no, I asked your assistant couple of times. So she said, I should be able to drive. She was like kind of acted surprised, but she said it's okay, don't worry, we'll make get you ready to drive. So the doctor is she was very nice, very caring and warm, because there were times when I had like tears coming out when the anesthesia effects was not right. She's like, I don't like tears in people's eyes, so she made sure she wipe out all the tears, because my hands were locked. So she got me some water, some ibuprofen. She said, okay, we'll make sure you have good tablets and all that make sure your dizziness goes away and you come back, you go drive in a better state. So luckily I drove fast, like on a 60-mile road I was driving 70. I don't know why. But I was fully awake. It was not like there was no risk. Reached home fine. And when I reached home, I suddenly, so I had rice. They told me eat a heavy breakfast because you'll not be able to eat for a good amount of time. And yeah, I got back home and they gave me medical prescription, so I had to go fetch the medicines as well after 2 3 hours. So I knew I can't sleep, and I thought when I go get the medicines, maybe I'll get some food as well. And that's where I got this sudden craving of Indian food and some tea. And they're like, you can't have hot foods. I'm like, okay, I'll make the tea cold and have it. I will, I'll not have it hot. So I went after getting my medicines. I went to an Indian store, got Khaman Dokla. Don't tell the doctor, don't tell anyone, don't try it. Uh, but Khaman, I removed all the, you know what you call the green chilies, and just spread it like that. It doesn't come as a solid one. It's not solid in general. It's a very crisp thing. But still, don't try Khaman on your the same day. It was tough, but I still had the numbing effect. So I just quickly had it. And with tea, I had biscuits, but I didn't have a lot of tea because I knew tea is acid. When you have strong wounds which are still healing, the blood clot comes out, the blood will start directly flowing. So you should not have tea or anything solid. Just rely on ice creams or banana shakes or anything. But next day I was ready. I was like, clearly I will have khichadis, banana shakes, and I got a lot of ice cream. But surprisingly, I slept at like good a little late, 12:30, 1 p.m. The next day, I woke up at 7:30 or 8 a.m. I had such a strong fever, and the body was so weak. It was snowing like crazy. It was cold. So I knew if I go into the living room, it will be cold as hell. My bedroom had my heater on. So 2.5 hours, 2 hours in my bed, just watching my phone, suffering from the fever. And I had an option. I could have went out, had some tablets, had something to eat, but tell a person who just got his tooth removed day before, so much of wound is there. He's having fever, is tired, to go get the medicines by yourself. But before the medicines, you have to eat. You can't have the medicines without eating. But for eating, you need to prepare something. So I was like, no, let it just pass. I'll get better. So more than 2 hours like this, just in the fever zone. Luckily, the doctor called me. She's such a nice lady that she called me by herself, asking, "Hey, I just wanted to check up on you. How are you doing?" Because I knew you'll be going on your own, and are you having tablets and everything? I told her, "Hey, I'm having a fever and all." She just told me one thing, dude. There will be inflammation, and also fever is a byproduct. It's okay, but do not ignore food. Have your liquids, have your food, and have your tablets. You really need to have those antibiotics because the bacteria is all still inside. So just wake up, have it, you'll be all right. And I did just that. I had a good banana shake, and I mixed a lot of good things in it. A good smoothie. I made it a good smoothie, and then I had my tablets. By afternoon, I was all right. There's no fever, but I was still very tired. Like so, so far no pain. I never had strong pain so far. uh, they gave me good basic medications, pain medications, but I just ended up having antibiotics. And pain meds I just had in the night. Like I thought in the middle of the night it might pain, so for 2 days I had pain meds. But yeah, it was not necessary, to be honest. Like I didn't get like the hell amount of pain, and I'll tell you maybe why. Because of my previous big surgery where I had a month of swelling. i I developed good amount of pain tolerance, I would say. That some basic pain is okay for me. So but maybe it's a unique case this time. So yeah, so day one was feverish, tired. Day two was similar. I woke up tired, not a lot of fever, but I was very tired. Like I got fever twice yesterday and the day before, and the next day it was just Netflix on my sofa with a very good ghee khichdi. So for next couple of days, two, full day twice, day three twice, I made very good ghee khichdi. First day was normal, basic tomato and onion and nothing, just ghee and some namak and light black pepper for taste. Next day I made a palak khichdi, again ghee based, because I felt I needed a lot of strong liquids, and I made a good smoothie as well, that had all the probiotics. I knew protein is a must. And day three, perfect, no pains, nothing, and I felt healed. So that was the beauty. And yeah, day four went fine. I've been working for last 2 days, and today, day six, the doctor asked me to come for post-op, and she looked me for like just for a minute. She opened my mouth and like, dude, you are healed much better than I expected. How come everything is healed? How come you look pretty good, no swelling? And you said you never had swelling. I'm like, yeah, I never had swelling somehow. I didn't tell her that, hey, tell your all your patients to have like good ghee khichdis or all the what, I don't know what, I don't know if it worked, right? Just maybe I was lucky this time. So yeah, that was my wisdom tooth story. Feels good now, and the doctor got so optimistic that she says, "Let's wait for 10 days, and I'll get the other two out." I'm like, "What? I thought we'll wait couple of months. There's a lot of wound, and they're like, no, you're healed. You're good. So let's have the other two out because she wants to do other things around, fixing everything around the jaw line and making sure I have every teeth aligned and all. So that's optional extra stuff. But still, she now wants me to go through it after 2 weeks. So let's see what happens after 2 weeks if I'm ready for the second one, and if I don't have pain in the second one as well, maybe I'm doing good. Else this was a fluke. So yeah, so that was the first round of wisdom tooth. Let's say how the second round goes. So if you are having it, don't be afraid. Have enough good liquid food stored. I relied on ice cream, but I somehow ice cream doesn't taste good in that time. Like somehow I didn't feel like having. I craved more salty food. So do have your backup salty foods. I have multiple options like mashed potatoes and khichdi's, and there's a lot of good options you can find on internet. So yeah, don't be afraid. It's more about not allowing this place to move a lot wherever you got it operated. Just be like this. Be quiet for 3 days at least. Don't speak like randomly like what I'm speaking right now. I've spoken a lot I guess today. So yeah, that was my experience, and that's it for today. And next edition, I'll come up with some other experience. Maybe I'll start talking about the major surgery I had. I want to do it in parts, more around pre, during, post, post. So I feel that will come soon. Maybe weekend I'll do one more, and that's it. And I'm not looking for any like, share, subscribe, so it's fine. Even this is the trend in 2021, okay, where every person posts something on YouTube is like, please like, share, and subscribe. And no, it's just for myself or somebody maybe in future wants to know me, posting this random videos. So thank you, bye bye.